The purpose of this video is to provide some basic instructions as far as sling wear, putting it on and off safely, and to teach you some simple exercises to do immediately following basic rotator cuff repair surgery. So the first thing that's important to know is how to safely take off the sling. You want to make sure that you don't do any active motion of your arm because we have to protect it because it's healing. One of the easiest ways to do this is to use your countertop, where you can rest your arm down onto the countertop. And then using your other hands, you should be able to unhook both the shoulder strap and the waist strap. So this way your arm is completely supported, you're not having to do any active motion of your arm, which you're not allowed to do for at least 4 to 6 weeks post-op after rotator cuff repair. And you can use your non-operative arm to help the operative arm as needed, and then it's basically a reverse process going back into it. This part is adjustable as well as this part. It's all Velcro. Velcro's out and back here, and then same thing on the other side, Velcro is out and back. If you've purchased the sling, it's all yours, so you can cut it. And then there's also a cushioned part on the back here, and this should actually be moved a little bit further forward so that it's cushioning you here so the strap isn't digging into your muscles here. So those are adjustable, and you can cut them if they're too long. Same thing with this piece, it's Velcro. You want to make sure that it's tight enough that it's keeping this close to your body and there's not a whole lot of movement of this. And then as far as the length of this part, you want to make sure that it's tight enough that you can feel your elbow hitting the bottom of the sling, so it should feel supported. It shouldn't feel like your arm is hanging down. These type of slings come with a little squishy ball attached to them, and this can be used to do grip strengthening exercises. So you can work on that several times throughout the day, a couple minutes squeezing whenever you want to. So you have that, and then you also want to make sure that you keep your wrist active so it doesn't get stiff. You can do circles around, you can do up and down, you can do palm up, palm down. Wrist motions are completely safe to do.
Okay, so now I'd like to demonstrate some basic exercise for following rotator cuff surgery. You want to make sure you're laying down with your surgical arm supported either by a rolled up towel, a pillow, something so that it's not going behind your body at all. You're going to take your wand or a stick, a yardstick, a cane works really well for this, and cup the end with your surgical arm. Your good arm is just going to grab the stick on the other end, and you're going to keep the surgical elbow bent as you push with the good arm, so that you're rotating at the shoulder and not straightening out the elbow. So a lot of times people will go wrong here in just straightening the elbow and bending. That's not the motion we want. So correct is to keep the elbow at 90, push out, and push in. And the good arm is doing all of the work here. The surgical arm is relaxed. Your therapist also may instruct you in elbow range of motion and actively moving your elbow. So you can do this in the same position. Make sure your surgical arm is supported by a pillow or a rolled up towel, and just bend your elbow slowly, or straighten it slowly first. Bend it up, touch your shoulder, try to get all the way up and then all the way down. Just very slow, very controlled. There should be no pain in the shoulder with this. –
Recovery varies a lot by patient. Surgeon recommendations also vary according to the severity of the rotator cuff repair. Follow closely your physical therapist and your surgeon's instructions. They will guide you exactly what you need to do. The main thing is just to be very cautious, very careful, and not to use that arm during the first 4 to 6 weeks after surgery.